My name is Shari, and this is the Heavily Metalled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll.
Hello, metalheads, and welcome to the jungle. Thank you for coming back today to this episode of the Heavily Metalled Podcast. We have a returning guest that I just adore. We have Dr. Laura Duzett. She is the author and guru of the Low Nickel Diet Cookbook and so much more. And she is coming on today to talk with us about something that we haven't really gone deep into. I know I need to go deep into this, so I know you need to go deep into this. And this is the mast cell activation and histamine symptoms that come with our systemic nickel allergy. And some of you that follow me, you have a lot of implants and stuff like this, and maybe you haven't gotten so far into this, but I know I have a lot of followers too that follow just because they know they're systemically allergic from a diet and lifestyle point. And Laura has all the things that I will probably not have for a long time. So thank you, Laura. And she is Dr. Laura now. She is out of medical school, prepping for your boards.
Yeah, I've got my final boards in 3 weeks. Yeah.
So we're so excited to have you here. Tell us about your quick 90-second update and tell us what's new, what's going on.
Yeah, so I'll just introduce myself just in case people don't know who I am. So like you said, Dr. Laura Duzett now, very exciting. I'm a physician and doing advanced training in pathology now. So I'm a pathology resident. And then I also have training in nutritional therapy. And I basically really love to combine that natural medicine and Western medicine, but with a focus in real scientific grounding. I feel like that's really what's missing in medicine right now. So that's my big philosophy.
Can I ask you a quick question for some of the listeners who may not know? What is pathology to those who may not know? Why does it give you a unique lens on immune reactions?
Yeah, most people don't know about pathology or what a pathologist is. I definitely didn't before medical school. But a pathologist is a physician that specializes in the deep understanding of disease, all the mechanisms of disease, and then the proper diagnosis of those diseases. We specialize in all that lab work, all the lab testing that people do, in reading biopsies that you get, in cancer resections, in diagnosing cancers, in the genetics, in the molecular testing, in autopsies, and all of those are unique subspecialties as well. So after I do this training, I will probably do subspecialty training. So we're the doctors that tell your clinicians the information that they need to know to make a treatment plan. So the doctors that you see in person, they specialize in how to treat disease. They don't always specialize in understanding the root cause and in the testing of disease. We're kind of like the doctor's doctor. We're the backup doctors.
They don't have time to go into this with their patient load.
No.
And the one thing I appreciate about your work specifically, and I've been binging so much of your content, is it's very data-driven instead of fear-driven. And I think that's really important. And I think, correct me if I'm wrong, but I think at one point you were going to go into dermatology, and I see pathology serving this community so much better, from that standpoint, because you're going to dive into stuff that nobody else is doing. You're really going to pave a way here.
Yeah, you're so right. I think I loved my time with patients in medical school. I love working with people one-on-one. Usually it's your third year of medical school that you spend in the clinic and you experience a bunch of different types of specialties. And that third year, I found myself getting so depressed. And the only joy I could find was with talking with patients. But I was like, why am I getting so sad? I really wanted to become a doctor. And I figured it out. It was because I was spending not enough time with the patients and then also not enough time with the science. There is no time to be close to the science, to be making sure that you're like reading all of the papers that are relevant to your patients. There's no time for that.
No.
And as a pathologist, you get the time to do that. We are constantly looking at papers, spending times with the chart to really get the diagnosis correct. And that made me very happy. So that's why I like it.
That's awesome. So let's get into talking about the 3 types of nickel allergies is our setup here and bring us all up to speed.
Yeah, I think this is a clarification point that I feel like a lot of doctors, obviously, they don't understand. And so therefore, patients don't really understand. And it's that there are 3 different kinds of nickel allergy. One is the kind that most people know about, which is on the skin. So from a buckle or your earrings or something like that. And I had that as a kid. I couldn't wear jewelry and stuff like that without getting a rash.
And that's the one doctors are taught about most in medical school, right?
Exactly. And the test that you take for that is a patch test. And that only tests that. It doesn't test anything else. But we can talk about that later. Then you have allergic contact mucositis, and it's very similar to on the skin. It's just your inside skin. So your mouth, your digestive tract from your esophagus, your stomach, your small intestine, your large intestine, your rectum. So that's allergic contact mucositis.
Can you have that without the skin one?
Yes, you can have all of these independent of each other, and they can develop over time and feed into each other.
Got it.
And testing for that does not exist in the United States, but it does exist in research labs, and I think it is available in some places in Europe.
Okay.
And then the third one is the one that you are very oriented with, unfortunately, and that's the systemic nickel allergy, and that is when other places in your body, other lymph nodes and immune cells get sensitized to nickel and then can impact all the systems in your body potentially and trigger the skin symptoms and the gut symptoms without the nickel actually touching the skin or touching the gut. Your previous videos have gone into this a little bit. Yeah.
So 2 questions here. So basically, not all nickel allergy looks like a rash, right?
Yeah.
And could somebody have systemic symptoms and never have had an obvious jewelry reaction?
Yeah, 100%.
Okay. All right.
Yeah, and that was me. For example, so when I was diagnosed in 2016, it was because I had really bad eczema on my hand called dyshidrotic eczema. Now, I'd never had that before, even though I had contact dermatitis elsewhere, but this was from systemic allergy to nickel. And that's because this is where most of your sweat glands are. You have the highest amount of eccrine sweat glands here. In your body, one of the ways that it gets rid of systemic nickel is through your sweat. And so if you're getting a lot of nickel release, you can develop an immune response on your hand as the nickel is trying to get out of your hands.
And I get it in my armpits. I can tell if I eat something high nickel, the next day I've got rashes under my armpits.
Yes, that's why you can also get it around your mouth and like on your face and stuff like that. So that would be more of a systemic dermatological response, not from the outside. Memory cells will go to places that your body has seen nickel before on the outside because there are memory cells that when they get triggered with nickel, they're like, oh, I know where nickel is. I've been homed. Basically, they get a little address in their little minds just to anthropomorphize them, that they go to where they initially saw nickel instead of where the nickel is coming from.
And I can tell you where I'm going to break out because if I eat high nickel, it goes to where I've had an implant removed or I still have an implant and it shows up right in those places.
Yes.
So, but it's like you said, you have different cell populations, different tissues, and they're all completely different tests, right?
Yes. And for example, with the skin, let's say you get sensitized on the skin. So you have lymph nodes. You know what lymph nodes are, right?
Some of my population may not.
Imagine little bean size, maybe little peas. They're like homes for your immune system, and they are in different parts of your body. And that is so that your immune system has little stations where they can be closer to where problems may arise. So they can get there faster, they can address the issue as quickly as possible. So let's say that you have an immune cell that sees nickel and thinks that it's bad, and it wants to report back to, think of them as little police stations. And so it goes to its local police station and it shows the picture of the nickel to all of the police force in the police station, that police station. And that police station is in charge of that area. And so only the cells there, they are only concerned about that. They're not necessarily going to tell other areas of your body, like, hey, you guys look out for this. And so you got to think about that. That's very relevant for why one test doesn't work for all things. A lot of these immune cells are focused on a specific area. They only stay in that area. They only go back to that area. And so that's the problem. When you get the systemic nickel going through, it can end up showing up in that police station. And then that police station thinks, oh, we need to go attack over here, even though the nickel isn't over there. But if you're testing those cells, you may think that it's for everything, but it's not. It's just for that arm. You know what I'm saying?
Yeah, we can come back to testing, but it sounds like we don't have a test that's irrelevant or that we can throw out with the bathwater because they're all needed at some point here. So it's just we just don't have the perfect test. We need all of them, unfortunately.
And people need to understand what each test is good for and what the limitations are so that they understand what information they're getting and what they should do with that information. You know what I mean? So when I originally wrote the book, I was really frustrated when I was trying to figure out how to eat the low nickel diet. I was frustrated with the resources that were out there. They were focused on just getting the amount of nickel low and what to eat to get the amount of nickel low, but none of them were focused on how to promote the body's natural ability to heal, how to address some of the root causes of why this happened in the first place, of why the body's freaking out, and how to calm it down, right? And
how to get those nutritional gaps too.
Yeah, exactly. And so when I decided to write the book, I decided to make it simple, as supercharged as possible, with that focus of how can we formulate a low nickel diet to address those root causes. And one of the big things I focused on was gut health, because that is the way that the nickel is getting through. And I'm a big believer in the gut being a huge foundation to health. That's how you get your nutrients. That's where most of your immune system lives, all of those things. But since I graduated from medical school, my knowledge just continues to grow. And that's why I love this profession so much. But since going into residency, I have now spent every week focused on one little piece of this hypersensitivity and trying to dive deep into it and improve my understanding of it. And then I share that on my YouTube lives every Sunday, on my website, all that kind of stuff, to try to improve how we can understand, how we can test, how we can treat this hypersensitivity. And when I got to really digging into the gut health aspect of it, I discovered I was definitely on the right track with that, because I discovered even more reasons why a really well-formulated low nickel diet should focus on gut health. And this is hugely important to your community because, like I talked about earlier, the body tries to get rid of nickel through sweat. It also tries to get rid of it through your bile. And your bile comes through your gallbladder into your small intestine. And so the nickel that is being released by your implants, your body's trying to get rid of, and it gets rid of it through the bile, which ends up in the digestive tract. And if your digestive tract is not properly closed off to nickel and nice and strong, then that is just going to be reabsorbed back in and keep that vicious cycle happening. And so that is one of the biggest reasons why you should focus on that.
And we're also saying that two people can eat the exact same meal potentially and absorb very different amounts of nickel based on the state of their gut, correct?
Yes, that was one of the biggest findings that I saw, was some research showing that you have somebody with this hypersensitivity and not with this hypersensitivity, and you feed them the exact same meal, and the person who is sensitive to nickel actually absorbs more. So there is something, or a multitude of things, which is my thesis, a multitude of reasons why more nickel is getting through in those people. And one of them is dysbiosis, so your microbiome being unbalanced. Also, like having gluten will open up the tight junctions between the cells, allowing more nickel through. If you are low in iron, your body will upregulate or make more of a specific transporter called the DMT1 transporter, which is to draw in more iron, but it will also draw in more nickel. It'll draw in more cobalt, which is a common double sensitization that people get. And so if you are low in iron, your body is going to try to get more iron, but it will end up getting more nickel as well. Additionally, if you have a hypersensitivity and some things are coming through, your mast cells are going to be triggered by nickel. If they're already seeing things that they're allergic to, they're getting these systemic inflammatory responses, they're going to be more sensitive and they're going to release histamine, they're going to release tryptase. That will also increase the permeability of your gut lining. And so there's all of these reasons why somebody who has developed this hypersensitivity ends up with this vicious cycle in their gut. that keeps allowing things through, that somebody without that hypersensitivity doesn't have that issue as much. And so that's why making the diet support closing those gates is so important, even if your issue is only the implant that you have.
So can I ask you, for my patient population, we hear the term mast cells all the time. Can you really quickly dictate what a mast cell is and what its responsibility is?
Yeah, that's a great question. I think it's been interesting. Mast cells are not really an immune cell that most doctors ever think about or talk about, including pathologists. And it's very interesting to me. The more that I learn, the more I love the mast cell. The metaphor would be a mast cell is like a night watchman. The mast cell goes to a specific tissue. Usually it's a tissue that faces the outside. So the skin, the gut lining, and some other organs as well, and is looking for intruders. And one of the most common ways that it gets triggered is IgE. But it can also be triggered, and this was one of the big findings that I've had this year as well. It can be directly triggered by nickel. You don't need to be allergic to nickel. Nickel on its own, if it gets through and it faces a mast cell, it will cause the mast cell to release what it has in its little backpack. And its little backpack is filled with granules. And there's a bunch of different ones. There's one called histamine, which most people have heard of, tryptase, and a bunch of other ones. And they're basically signaling all the cells around it that there's an intruder, and they all need to be sensitive and ready to go and start changing the openings in your gut lining, the openings in your vasculature, so your bloodstream, opening those walls and make those walls leaky so more immune cells can get through, so more fluids can get through. And the whole purpose is seeing that there's an intruder and getting everyone involved. And so that's where people with mast cell activation syndrome or histamine intolerance or people with systemic nickel allergy will get flushing, hives, headaches, itchiness, stuff like that. That comes from a mast cell. And what's funny about mast cells is a lot of people focus on the histamine, but there's not actually a lot of histamine that gets released by mast cells. Mostly it is tryptase, and tryptase is what starts making damage around the area and also signals the other cells to be more sensitive to histamine, so that if it keeps sending out histamine, all the cells are already prepared and ready to go to make their reaction even stronger.
So it's histamine and tryptase and all these things released by the mast cells that increase permeability and make absorption worse in the gut and cause the dysbiosis. Is that correct?
Yes, you totally got it.
And then I'm going to ask you a personal question here. So the first thing that I knew when I heard the general list of high nickel foods was gluten-free grains were very high. So I'm like, okay, then I don't have to eat gluten-free grains anymore because I was gluten-free for 10 years. I can just have real gluten. And then I went back to white gluten, white sourdough bread. It's probably causing problems. Would it be your hypothesis that any gluten, even if it's white gluten or a gluten-free high nickel grain, is still going to be a problem for the intestinal permeability thing, and we should completely stay away from it no matter what?
Let me answer that first with what the facts are, and then what my recommendation usually is to people. So the fact is that glutinous grains do, no matter who you are, create intestinal permeability. Now, the degree to which that permeability occurs, it's not necessarily super crazy on its own, just a little bit here and there. As far as the literature shows, it just does happen. It does create the openings in the tight junctions. That's just a fact. If you are trying to reduce things getting through as much as possible, then you may want to reduce your gluten, right? Especially if it's a meal that has higher nickel foods in it, right? What I usually recommend is if you're at the beginning of your journey, you're just starting, if you have high symptom burden, so you have a lot of symptoms going on, huge flare, you're really uncomfortable, I recommend doing whatever you can to make those tight junctions tight. Do whatever you can, do it for 3 months straight. Just do that for 3 months straight until your body is calm. And then you can choose some of the things to be a little bit looser about.
Maybe if it's the holidays and you want a nice piece of fresh baked white sourdough bread, have a piece.
Yeah, think about the whole context. And that's why it's so good to educate patients about this stuff. Educate yourself about it because it's not super black and white. The more educated you are, the more you can tweak things to be relevant for your situation, right?
Sure.
So if you want to have some gluten, like, okay, cool. I'm going to also supplement with vitamin C during this meal because vitamin C will help chelate and hold on to some of the nickel so that it cannot cross.
After the holidays, I'm going to go back to being strict for a couple months and then we'll see where we're at after that, right? So it doesn't have to be completely black or white, all or nothing, never ever. So that makes it mentally a little more digestible.
And I can tell you, and this is one of the things people like, they get so sad at the beginning, and I understand because I did too. They're like, oh, I can never have chocolate again. I can never have beans again. I can never whatever again. For a lot of people, not everyone, but for a lot of people, if they're able to reduce the amount of nickel that their immune cells are seeing for long enough, your body is constantly trying to preserve energy, and it will kill off immune cells that are looking for nickel if it thinks nickel is not coming around anymore. If it hasn't seen it in 6 months, it's, you know what? I don't need you anymore. Let's get rid of you. Let's put you on a different assignment, whatever. And so over time, you can reduce your reactivity to it. You will not be able to get rid of it, but you can reduce it so that you can then be more flexible. You just want to make sure you don't resensitize yourself and get your immune system revved up again, making more cells to look for it. And so, for example, now for me, I've been doing this for 10 years now. I would say a couple of years ago, I started eating more gluten. I started eating more beans. I started eating more chocolate. And I probably have chocolate at least once or twice a week. I probably have gluten at least 2 or 3 times a week now. Now, I did start getting some other symptoms in the last year. And so now I'm more strict again because I'm worried that I'm going to hypersensitize myself again. But you can, over time, end up being so much more flexible. And especially with the things that you learn as you ramp up, the strategies that you can learn to reduce your reaction, to get rid of the nickel as quickly as possible, to chelate the nickel naturally through the foods that you're eating. You can learn all these strategies to help yourself not do that. Right.
Okay, let's talk about the nickel histamine chart, the mast cells and the nickel histamine chart that you have, because I thought that was really fascinating, and I definitely don't want to skip time on that.
Yes, it's like crown jewel of my year, I would say. I am so excited about it. I said earlier, every week I deep dive into something, and I'm always learning new things and getting excited and making those connections like I told you about. But this one really took the cake because absolutely no one has put all of these things together yet. And so I will be trying to publish it this summer in the scientific literature. I really need to get it out there because it's potentially a huge deal for a lot of people and could help a lot of people just understand where this is coming from and that they may be focusing on the wrong things. We talked earlier about how obsessed I am with people focus so much of their advice, especially around histamine intolerance and mast cell activation, on addressing these downstream effects. And I'm so obsessed with understanding mechanisms so we can put our efforts into the few things that have the biggest bang for our buck. Because especially like you and I were talking about before this, like when someone has a really high symptom burden, they don't have the energy to do a million different things perfectly and cook everything perfectly all the time. Like nobody has that energy. You need to use the very little energy that you have to do the thing that's going to help you the most. So that is why I get so excited about stuff like this. The week that I did my deep dive on histamine intolerance and really mapped out all the pathways of histamine production and management, and then identified where nickel fits into that and where it influences it, I was completely floored because nickel doesn't just bump histamine through it triggers mast cells and mast cells will release histamine. That is just one of 5 different ways that I found in the whole chart that nickel influences. It influences every piece of it. I basically realized that this low histamine diet that people use is number 3 on the most powerful thing that people could do to address that main root cause. So let's put up the picture and I'll walk you through some of these nerdy little impacts on here.
No, this is exactly why I wanted this episode because nobody goes here and I need to go here. We all need to go here, y'all.
Yeah, see, you're one of my people. And that's the people who follow me. They're definitely the people who love the science aspect of it. They like to understand why things are happening. So I'm good for that. So I'll help those people.
I would say 50% of the people that really struggle with this don't really have the brain space to want to heal. They're just going to stay in it.
What do you mean by that?
I feel like I come across a lot of people that have the pain and the symptoms and the nickel allergy and the fibromyalgia and all the things. And you tell them about the testing or you tell them about the diet or you tell them about things they can do to help themselves and they just take no action. They just seem to want to stay in their story and in that place. And then there's people like you and me who are driven to improve our quality of life and to keep getting better and to advocate for others and to pass it on. And I'm just sad for the people who can't find that in them at this time. And I hope that as the data becomes more common and it becomes maybe easier, there's more information, there's more recognition, that maybe they will be encouraged to take some action.
I think that's a really smart observation. The work that you do is so important in bringing awareness, because even the deep dive that I'm doing this week is on implants and systemic nickel allergy from implants. And my knowledge on this wasn't that great. I was really focused on just getting the diet and getting the diet right. But as I've researched this week, man, I really commend you for the work that you do. I'm just so grateful that you keep pushing.
Thank you.
Now that I've seen the research, it does not even address systemic nickel allergy. It's patch testing, which doesn't tell you anything about
and people, it's so rewarding because you see people that go in and get 3 gallbladder clips removed and 10 years of fibromyalgia goes out the door when they wake up in the OR. But then I also have somebody who waiting on a new total joint for a knee, and they were completely disabled, couldn't walk, couldn't anything. We brought on some of your resources and the low nickel diet. That is all they changed. And adding an H1 and an H2 blocker, they are off all pain meds and they can walk, they can function. That is in spite of not having the knee revision yet. So we cannot say that diet, even if you have implants, it's not all about getting the revision or the metal change. That's going to take a hot minute. This is stuff you can do here, right now to improve your quality of life substantially. So, okay, back to the chart. Let's go. Sorry to keep taking you down a rabbit hole.
That's all right. Okay, so we'll start with the mast cells. The research has shown that nickel will directly attach onto this receptor called toll-like receptor 4. And that receptor is on mast cells, and that's how the nickel causes them to degranulate. So unzip their backpack and release all of their granules. So nickel binds that directly. The mast cells degranulate. They release histamine and tryptase. And like I said, tryptase activates something called PAR2, which lowers the H1 threshold. So the same histamine will bother you more. And mast cell degranulation is the largest source of systemic histamine. And DAO, that is like a histamine deactivator that exists in your small intestine and the lining of your small intestine on the microvilli there. And so that's where DAO comes in. ER alpha, so this is a receptor for estrogen. Nickel acts as a metalloestrogen. This was another thing that I learned this year. So it can also bind to ER alpha, which is one of the estrogen receptors. And so it binds that, and that upregulates HRH1 gene, which causes there to be more H1 receptors on cells. So histamine attaches to H1, and that's like a inflammatory signal.
So 2 questions there. Number one, does this metalloestrogen effect potentially help explain why women may be disproportionately affected? And then second, having the extra H1, it basically in layman's terms is going to mean more inflammation in that pathway because of this effect on that receptor. Is that right?
Yeah, you know those boxes they'll put people in and they'll float a bunch of money and you grab as much money as you possibly can.
Okay, yeah.
So this is like giving you more arms and hands. So if there's more arms and hands on each cell, it can grab onto even more.
Okay.
Does that make sense?
Yes, so that causes more inflammation.
Exactly. So the signal will be much larger because there's more chance for that signal to occur, for that communication to occur. Okay. So yeah, anytime someone says upregulating this receptor, that just means now there's more hands to grab more dollar bills.
Okay.
Yeah.
With this receptor, could hormone fluctuations worsen symptoms, or it sounds like histamine reactions for sure?
Yeah.
What are your thoughts on that?
That's why when women go through menopause or they come in and out of pregnancy, that's one of the reasons why people can have a really great pregnancy with no symptoms, and then they end their pregnancy and then all of a sudden their symptoms come back. So there's a huge hormonal angle to it. And that will be one of my deep dives very soon is on that. But yeah, I talk about that in the histamine and the mast cell videos as well, deep dives as well.
Okay. So now we've got these upregulated H1 receptors. Yes. Where do we go from there?
More receptors to grab more dollar bills. And then DAO suppression. So we talked about DAO, and that exists only in your intestines, okay? And that is meant to be able to kind of calm down excess histamine. So the same estrogen receptor alpha pathway also suppresses the gene that makes DAO. So the more nickel that gets into those estrogen receptors, then the less DAO is made in the gut lining. That means more histamine can get through into your systemic circulation and cause systemic histamine responses. So back up real quick on the histamine part. If you think that you have a histamine issue, if it's digestive, that's like within your gut tract. But if it's a systemic thing, like the flushing, the hives, the itching, that is from internal handling of histamine, which doesn't have anything to do with DAO. And taking a DAO supplement is not going to get into your systemic circulation. Just everybody should know that.
Interesting. So in short, somebody may think that they've developed a sudden histamine intolerance when nickel is absolutely actually contributing to the overload.
Yes, that's exactly what this taught me.
Okay.
Yes.
Very,
and
very
so
important.
addressing that is going to address the root cause more than taking the DAO. Okay.
Got it.
Okay, so that's number 3. Number 4, NF-kappa B and HDC upregulation. So the toll-like receptor 4 activation, that will release something called NF-kappa B. That's an inflammatory signal as well. And that upregulates HDC, which makes histamine from histidine. And this is a systemic making of histamine. So your body will manufacture more histamine internally. And that has nothing to do with what you ate, other than nickel. If nickel gets through from what you ate or what you drank, then that NF-kappa B will cause more histamine to be made. Histamine is a good thing. It's got really good things that it tries to do in your body. It keeps you awake, it makes you alert, it makes you focused, but you don't want too much and you don't want to be too sensitive to it, right?
So to restate that back, the body may not be only reacting to histamine, it may actually be producing more histamine, correct?
Yes. And at the same time, through these other mechanisms, the cells are also now more sensitive to it, to the same amount of histamine. That if that same amount of histamine was transported into your body without these issues, they would not have this problem. Because their cells don't have the other signals that you're getting from the nickel and from the inflammation that is making everybody super sensitive.
And everything's upregulated and hands everywhere.
Yes. Yes, too many hands. It's getting too handsy in here. Yes.
So then we move on to oxidative stress, right?
Yes, the oxidative stress is caused by the systemic nickel allergy. That causes HNMT failure. And HNMT is like your internal DAO. It's the one that tries to calm down if there's excess histamine. So there's all these beautiful functions in your body to try to keep things at an even keel. You want histamine, you don't want too much histamine. You want histamine, but not too much sensitivity to histamine. So this is one of the other things. Your body's ability to calm it down is then negatively impacted by your systemic nickel allergy.
Got it. So we can't clear it.
And there's also a genetic variant of HNMT, and it's actually quite a bit of the population, like up to 25% of the population, that makes it more sensitive.
Okay. So you said that this is the piece that nobody's talking about, why histamine intolerance and SNAS travel together. Elaborate.
Yes.
Just this chart, just not understanding this.
Yeah, people really focus on the diet. They think if I just reduce my histamine in the diet, then that will be fine. Not realizing that the diet is the least issue. You want to address the mast cells. You want to address the nickel getting through, the systemic processing of it. And all of that has to do with that gut health piece and not allowing nickel through.
Yeah. How do we do that? How do we stabilize these mast cells? And how do we stabilize everything in this chart? How do we stabilize that part if it's not through diet alone? What's going to get us the most bang for our buck? Obviously, it's going to be a work in progress for a long time. Where can we start with that? Is there testing for these receptors? How do we do it? Where do we start?
So there are many strategies to calm mast cells. And there are some tests you could do to see if your mast cells are producing more tryptase. They're not perfect tests, and it's going to depend on the timing of when your mast cells were most recently upset. So really, if you think that your mast cells are overreacting, the most important thing is to reduce the things that the mast cells are seeing that are upsetting them, right? So that's where a low nickel diet is helpful. You're reducing that nickel that can just directly impact the mast cells. Additionally, you can improve your sleep. Sleep is a good one because by improving your sleep, you will be improving your mast cells and calming them down, while also improving your overall health and well-being and other immune cell functions and all of that kind of stuff. I just did a recent deep dive on sleep and its impact on systemic nickel allergies.
Oh, that was
So
such a good episode.
So there's a lot of good things there. This is something that I have changed my opinion on, and that is the importance of fiber and of resistant starch. So that does impact mast cells. And so resistant starch from a cooked and cooled potato or rice, that increases butyrate production in the colon. That butyrate acts similarly to cromolyn sodium, which is one of the treatments for mast cell activation syndrome. It uses the same mechanism and helps calm and stabilize the mast cells. Also, glycine before bed, that can help. So that's why I'm a big fan of making homemade chicken broth with a lot of chicken feet in it. So you can get a lot of the...
Sounds so gross.
It does, but now I look at chicken feet and I'm like, oh, look at all that beautiful collagen, like all of the nutrients in those feet that support the gut health and the stabilization of the mast cells. Like, it's a beautiful thing. So I really recommend that. Also, for mast cell stabilization, there's also something called PHGG, and I have a bunch of recommendations of different supplements one could take. Now, I don't like people to take a lot of supplements when they're at the beginning. A lot of supplements have nickel in them, unfortunately, from the manufacturing process. You want to really minimize that, but as far as mast cell stabilization is concerned, I do think it's worth trying at least one supplement for that.
So what I think would be best is to tell people we're just scratching the surface today on this. Laura's channel, Laura does a live every Sunday. She answers questions. She does a deep dive, a different section. I'm sure that there are videos here that we're going to address exactly what we're talking about right now, and that you're going to go into it in more depth. Can you think of an episode or two that we could send people from this point to dive deeper in this section of what we're talking about? So you don't have to beat yourself here.
Yeah, the one on histamine intolerance and the one on mast cell activation syndrome. I did 2 specific deep dives on that.
We'll put links to both of these in the show notes. So that'll be great. And every one of my followers needs to be following Laura, because this is a piece that I don't go into as much in depth as she is able to. And it's going to just help us all.
And I just keep growing by knowledge here. That's the thing, is we just need to keep looking into the literature and finding these new connections that are relevant to our condition, right? That we can implement in our unique personalized protocols.
And I'm excited to have you on board in the community for other reasons. I do want to introduce you to Dr. Scott Schroeder, because there could be some studies and some stuff in pathology that you could
I would love to do work with him.
He's doing such great things. He's got books coming out. He's got all kinds of studies, and working in pathology, you're going to be in a great place to really be in the center of a lot of that too. And I think it's just going to get exponentially better for all of us. Do you care if we jump and go ahead and talk about how we shouldn't be doing cold plunges? I wanted to go into that because I've always heard good things about that, but apparently there's some histamine consequences and some other things that we don't know about that, and it can affect mast cells negatively. Can we talk about that for a minute?
Yeah, sure. I haven't done a huge deep dive into cold plunging in general. It was just some papers that I found when I did the sleeping deep dive that I was surprised to find, because I knew some people will have poor response to heat. Their mast cells will be overreacted to heat. Like, I personally love doing sauna and steam room. I feel really good after that. It really helps release nickel through the skin and everything. But some people don't respond well to that. And so I never thought that something like cold plunge would be bad, but apparently that also causes mast cells to degranulate. So something like a cold in the face, just doing a cold plunge of your face, that does have positive sleep and calming reaction to it. But to do cold plunges is not good. And I personally do not respond well to cold plunges. I didn't know why. I almost passed out from one once. And so I don't do it. But
I have no thyroid. And so I can't regulate my body temperature anyway. It's always really low. I'm always freezing. So that was the last thing I wanted to do. But I've been hearing, you have to cold plunge. You have to cold plunge. It'll solve all your problems. You just gave me a pass on cold plunging.
No. And there's also recent research about cold plunging. It does not do all of the benefits that people think.
Okay, good. So I'm off of that.
Work against you. I'm not saying don't try it. Try for yourself. Just like I said, I do fine with heat. Love it. I feel amazing. It's so good for me. Yeah. Cold, not good for me. But there are people, it's going to be the opposite. So give it a shot.
And I have
tea.
an infrared sauna. I do really well with sauna for me. But I love that you're so not black or white. Even though you're a doctor and we're just having this educational talk here, we're not giving medical advice. You're really good to say, do what works for you. You don't have to do 100% of what I say. Do what
No,
works and take
no.
it as a piece of the puzzle and make up your own, what works for you, because we're all so individual.
Yeah, and we
Um,
don't know everything. I don't know everything. I'm trying to know everything. I'll never get there. But yeah, like just try to understand why you're doing it, what it is you're trying to see if it will help. Try to measure that if you can, and take a scientific approach. Try to learn about
mhm.
it, why it should work, and if it works for you, great.
Yeah. Let's talk about another couple of fun histamine things. Let's talk about
Okay.
the 2 to 3 a.m. wake up.
Yeah. Yeah. So a lot of people related to this, a lot more people than I thought would. This waking up at 2 to 3 a.m. So apparently, I didn't know this is a sign of a big release of mast cells of histamine, and this is a normal process that the body goes through for everybody. A release of histamine between 2 to 4 a.m. or whatnot, depending on when your body is used to going to sleep and waking up. A lot of people have heard of circadian rhythms and that you have the circadian rhythm and you need to make sure you're going to bed at the same time every morning, waking up at the same time, getting light in your eyes. So you're triggering all of the clocks in your body to be on the certain schedule. Well, mast cells have a clock too, and they like to wake up around the 1 to 2 a.m. time and they start releasing histamine. And that sounds very scary to people with histamine issues, right? But this is a normal part of beginning the process of waking your body up. And also, like the cortisol spike in the morning, that's really important. That helps start the cortisol spike in the morning to help you wake up and feel really good and have nice, clear thinking in the morning. But people with a lot of signal all day long, sensitizing their mast cells, all these things that we talked about earlier, that is going to make all your cells more sensitive to this histamine and more of those hands, right? There's more hands.
Yeah.
Everything's
And
really handsy. That little bit of histamine is overreacted in your mind, and that's why you wake up.
I do
Sure.
want to jump to the testing landscape. Can we spend a
Yeah.
few minutes there and talk about
Yeah.
the different types of tests? And I know that you've come out with some recent stuff that I felt like I pushed back on a little bit, hopefully not too hard, but I do want to go into this testing component because I think it's really important for all of the different tests to be understood and what they do and what they don't do and how people can bring that all together.
I don't remember exactly what you pushed back on.
Or it was the short where you called the LTT test a myth. I
A
think I just
myth.
pushed back on the strong language of it being a myth in the short that I saw. But let's clarify that for people because it wasn't all that when I have talked more since then. But let's start at the beginning with the patch test and let's just talk about that first.
Okay, a patch test on the skin is basically applying a certain amount of nickel on the skin and then giving a certain amount of time to see if the immune system makes a response on your skin, right? That only tests that local immune response.
And it will do nothing to test for systemic nickel allergy,
No,
correct?
no,
Nothing.
not at all. That would never prove a systemic reaction. It's literally impossible. Now, it doesn't mean that you don't have a systemic sensitivity, but you're
Got
not
it.
testing that by testing the skin. This has been researched, and it was shown by Dr. Picarelli, who's the best nickel researcher in the world, that a nickel patch test catches only 38% of people with systemic nickel allergy.
So then let's also talk for a second. I don't mean to throw anybody under the bus, but I got to bring it all up. The Sensiband test kit. Are you familiar with that?
Yeah, someone on my
So
live told me about it. I looked it up. I looked up what it was doing, and it's that. It's the same thing. It's only
yeah.
testing the skin's response.
And I did an episode with the inventor who was pretty convinced that it would show some systemic sensitivity. And he outlaid all the reasons in that episode. I'll let you go watch it. But I have not seen that experience. I have seen some actual false negatives with the Sensiband kit for people that it didn't
Yeah,
show up anything. And I know they're systemically allergic. That
yeah.
was a bit of a concern. Okay, let's move on to the oral mucosa test, which is something I didn't know much about till recently. Talk about what that
Yes.
is and what that's for.
Yeah, so it's the exact same idea, but for the mucosa, you have a different group of immune cells with different jobs and different sensitivity in your mucosa. In the lining, it's like inside skin, outside skin, inside skin, different types of immune cells, different types of sensitivities, different types of jobs, and also different location of that lymph node that we talked about. So the oral mucosal patch test is a patch test that's put in the mouth, and it's very similar It's a certain amount of time that they let that sit there. It's a different amount of nickel than is put on the skin, at least the way that Dr. Picarelli's group does it. And then they will use different methods to read the response about if there is shown to be a immune reaction to nickel in the mucosa. And what that can prove is if the immune system in your gastric mucosa has a sensitivity to nickel. That's all it proves. It doesn't prove systemic. It doesn't prove skin. It only proves that. It can't prove anything else. Now, if you don't have a response there, does that mean that you're not systemically allergic? No, you can be systemically allergic and not have an immune response in your gut lining.
Or on your skin or on the surface of your skin. So really important to drive this home.
Exactly. And I think it seems like nobody understands this. Like when I'm reading all of these research papers that we're trying to figure out, oh, are surgical implants causing systemic issues with people? And they're just using a patch test? I'm like, what the heck? This is not testing this at all. You may run into some people who also have derm response to nickel as well, because that is going to make them more likely to get systemic response. But that doesn't mean them not having that doesn't mean that they're not going to have a systemic immune response to the nickel. But almost every single research paper that I have seen only uses the skin patch test. And then a few of them do use the LTT test, the lymphocyte testing. And that's the best test to use for that. But it's still, that's the next test, which is lymphocyte test.
And now a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MALISA testing. MALISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit malisa.org to learn more and schedule your test. Trust us, you'll be glad you did. MALISA, a valuable diagnostic tool in medicine. Yeah, let's talk about that and what it tests for and what the limitations are as you see it with that test. I think it's not a myth. It's a valid test. It's just one in our group of tests that we can use to detect all of the different parts of this allergy. But it does bring some good information to the table. So let's talk about the LTT test for a minute. What its limitations are, what it does and what it doesn't do.
Yeah. And I'll have to rewatch that short because I would never say that test is a myth. What I would say is that can tell you if the lymphocytes make a response. They have seen it before. They know about it. I have watched the interviews that you've had with the creators of these tests and their explanations, which are great. And they do actually say what I'm about to say. What it does prove is that there are immune cells in your systemic circulation that are going around looking for nickel, that they have been taught what nickel looks like. But it's
and it
just
shows
like
the delayed response to the metal as well. It's like it's showing the cell proliferation over a couple of...
It's showing that it will have a type of recognition, that it will create a type of recognition of the nickel. So if you're going through airport security and they're taking an image of your face and they're checking to see, do we have this person in our system? It's like facial recognition. What they decide to do with that information, what actually happens, if they're going to arrest you, if they're going to let you on the plane, like all of that information is not given by the LTT test. But it does show that those cells have seen it and have been trained in it. Now, is it likely that there's going to be some kind of immune response? I would say yes, but that hasn't been proven yet. The problem is a lot of the validation tests that have been done, it's not all done the same way in all the same labs. And that's why a lot of people in the scientific community will just completely ignore the test because that validation hasn't happened. And that's a really important part of making a test be able to be used by everyone to benefit everyone in the same way and be reliable. And that's why people just shun it. I don't shun it. I see the benefit of it. And I think it's absolutely necessary, especially in your community, people making those decisions. It's just, we need to be clear that all you're doing is increasing the likelihood of that. Only way to know for sure is to reduce the nickel and see the response, right?
Sure. And I think what you're saying is that it's definitely not a useless test. It's a data point with good data. I don't know that if this is even a pushback, but I might say that I think there's some validation as to the amount of reactivity shown on the test, for example, I had a test in between when I had some implants taken out and then some new ones put in. And I had the same test with orthopedic analysis, and my reactivity went from a 6 on their reactive scale to over a 20. And I haven't pulled it again since I've had those implants out. But I think there is something to not only show the recognition of the cells, but there is a degree of reactivity that it is showing. And some people are much higher than others.
I like that about their test. I like that they test more than just lymphocytes as well. They test more of the environment of the group of immune cells and how they interact together, because that's where the immune system gets a lot more complicated than people realize. It's not just this cell does this and then this cell does this. If you put these two cells next to each other, then they're going to change. And then if you add these cells in the mix, all of a sudden that's going to change. I like that about their test.
And we haven't done the episode on this yet, but I think I just told you about this by email, is that Orthopedic Analysis just came out with a food LTT test that they've been working on for years and years called ImmunoGI, and we're going to have an episode on that in the fall. But yeah, I think we're just getting to so many different places. But going back to what you said, it's elimination and provocation that really are the things that are going to be telling once we have all these data points in, because the data points aren't perfect.
And there's some other tests that people are using in the literature, like IL-5, testing for IL-5. That is probably a better measurement of actual response of, are the cells actually creating an inflammatory response and sending all the signals. An IL-5 test is very good for that. It's not available yet. It's still in research.
You talk about F-alpha and IL-6 and IL-8, and these are interleukins for people who don't know. They're inflammatory markers. And I was going to ask you if those can be tested, because I'm one of those really interesting people. I don't have high inflammatory markers like that you would see with fibromyalgia. I don't have a high SED rate. I don't have high CRP. But I have all the hallmarks of fibro. But I would be highly suspect that I have really high TNF-alpha, high IL-6. Can those be tested at all?
There are ways to test them. It's just they're not commonly ordered or used, or often it's not worth the money because not enough people would test for them and all that kind of stuff. So it's one of those research only kind of things. But some of those things you can test for sure. It's just jumping through the hoops and all of that kind of stuff.
Got it.
And validating whether those tests are going to be helpful for a patient and a clinician making a decision about what to do. And that's another limitation, right? That's why ultimately what we have available testing wise, I would love to validate the OMPT test, the mucosal test here in the United States, because I think that's an important piece. But working with your clinician who's hopefully educated on this, or you help educate them on it, or hopefully I can help get this information out there, that they can utilize all of these resources together, including the low nickel diet, to help find out what changes does this patient need to make to reduce their symptoms. You know what I mean? Because maybe they don't need to remove an implant if they reduce their intake via the water and the food and reduce their symptoms enough. They don't have to go through that very traumatic and
I will go back to saying people are like, I have to get it all out now that I know it's there and now it's causing a problem. They get real fear-based. I have a ton of metal still in my body. I have a cage here. I have 6 implants in my pelvis, and I have an implant in my lumbar spine, and I have a good quality of life without having to have all that removed. So the thing is, if we can make a supportive environment, we bring in the data points, we do what we can to clean up, we bring in a supportive environment in our gut, we heal our gut, we in time add the right supplements, we learn all that we can about this allergy, you really can have a good quality of life without the implant revision having to be the thing. Not that it's not good if you can get it, but if you have to fight too hard, you can still have hope and still really have a good quality of life. What do you think the big takeaway is going to be? What would you want them to most understand if we just had to wrap it up in a pretty little box?
If you know you have systemic nickel allergy, if you think you have systemic nickel allergy, trying to pick the biggest bang for your buck things to try first, and don't try to do everything. Don't try to understand everything all at once. Just pick something big like the diet, maybe 1 or 2 lifestyle improvements like improving your sleep, reducing your stress. Try the diet, try it for 30 days. Just focus on those things and don't beat yourself up about anything else. And just focus on that. That would be the biggest bang for your buck thing. And don't listen to these people talking about supplements and all this, that, and the other little things. I feel like people get very fear-based, like you said. I feel like people get very hard on themselves and feel like they have to do a million things at once. When
Yeah.
really, if you just focus on the root cause and addressing
Yeah.
the root cause, that's going to have the downstream effects without you having to mess with all these little things.
Yep. And that is the diet plus the gut work. If you're waiting for implant removal or if you're just starting out, this is
Yep.
what Laura feels is what really moves the needle in spite of all the testing we have. And I
Yeah.
just think one of the big takeaways is that nickel sensitivity is far more systemic and multi-layered than even us in the middle of it realized.
Yes.
I think it's really important. So I want you to be able to talk about your book and where people can find you and tell us a little bit about your live and your community before we close out here.
Yeah, sure. Thanks for having me, Shari, and thank you for the work that you do. And I'm happy to help
Likewise.
any way that I can. And
I feel like we could just talk forever.
I know. But yeah, as far as where you can find me, my main website is the lownickeldiet.com. That's where my cookbook is. You can get it hardback or a PDF version. I am just starting a private community for people who need that extra focused help, need that more personalized, targeted
please.
protocols, especially if you've already started the diet and you're not seeing as much improvement as you need to make some personalized tweaks. That's a good place to go. So I'm starting that. And then I have my YouTube lives every week where I do a deep dive. And that's on Sundays on YouTube and Facebook at 11 Mountain Time. They are recorded so you can watch them later. That's where you can find me. I am hoping to open a practice that's just focused on people with systemic nickel allergy, just trying to improve the treatment that's really focused on that. We'll see if my residency will let me do that. But in the meantime, we can help in the community.
Thank you again, Laura, for coming on. I'm sure we'll be having you back. I want to urge everybody before we close out to go over to heavilymetal.com. There's a lot of resources, including Laura's on the resource page. There's a petition there to help facilities and your doctors pre-screen patients for metal hypersensitivity in their facilities and prior to procedures. That really needs to gain a lot of traction, and I'm sure we're going to have more good things coming. I'm still working on my Metal Allergy 101 course. Laura will be a part of that, as well as a lot of great information on implants and how you can suss out if that's part of your problem. I'm just really grateful that Laura is part of our community to come on in and help tell the medical community that we are suffering. We're tired of suffering and we're not going to take it anymore.
That's right.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.